Building trust through patient experience. How Vertical Health Services prioritizes compassion and communication. The first test of a skilled nursing facility often comes before a nurse checks a chart or a therapist begins an evaluation. It comes when a resident is wheeled through the door after a hospital stay, tired, uncertain, and surrounded by unfamiliar faces. It comes when a daughter asks when therapy will begin, or when a spouse wants to know who will call if something changes overnight. In those first minutes, families are deciding whether they can trust the people inside. Vertical Health Services, which manages skilled nursing facilities across multiple states, has made that moment central to its approach. The post-acute care provider operates under the mission, elevating care, enriching lives, with an emphasis on personalized care, transparent communication, and a setting designed to help residents feel known rather than processed. Families are not simply looking at whether a room is ready, CEO Bill Miller said. They are trying to determine whether we will communicate clearly and whether their loved one will be treated as an individual. Patient experience has become one of the clearest windows into healthcare quality. It follows every interaction, from admission and medication management to therapy and discharge planning. It can shape whether patients understand their care and speak when something is wrong. Miller believes the industry has too often confused the absence of complaints with the presence of quality. Traditionally, our industry has measured customer service by the absence of complaints, he said. Rather than simply avoiding dissatisfaction, we are committed to understanding what truly matters to those we serve. That difference is especially important in skilled nursing, where every resident arrives with a personal story, often following a serious illness, injury, or surgery. The transition may be routine for providers, but for residents and their families, it is deeply personal. Vertical Health Services listens before the survey arrives. Surveys, online reviews, and complaint logs can identify patterns in patient satisfaction. Their weakness is timing. By the time a concern appears in a formal report, the experience that caused it may be days or weeks old. A resident can be confused without complaining. A family member can praise the nursing staff while struggling to get a clear answer about therapy. A patient can follow a care plan while feeling shut out of the decisions behind it. Vertical Health Services uses traditional feedback tools, but it also tries to shorten the distance between a concern and the person who can address it. Through its Voice of the Customer initiative, facilities display boards with the names, photographs, and contact information of administrators and directors of nursing. New residents receive the same information during admission. We would much rather have conversations with residents and their families at the facility to find out what their needs are, Miller said. There is no substitute for face-to-face conversations. Patient feedback can expose weak handoffs or unclear routines. Repeated questions about shower schedules may point to a gap in the admission process. Confusion about therapy may show that care plans are being explained too late or in language that is too technical. Positive feedback matters, too. Common themes center on staff responsiveness, respectful communication, and the sense that someone took time to listen. Those patterns show what patients notice most. In patient-centered healthcare, listening is not a courtesy added to care. It is a source of operational intelligence. CEO Bill Miller. Every detail matters. Compassionate healthcare is easy to praise and harder to define. Patients usually recognize it in small decisions. It is the staff member who sits down instead of speaking from the doorway. It is the nurse who notices that a resident has become withdrawn. It is the administrator who returns after a difficult conversation rather than assuming silence means the problem is solved. Vertical Health Services frames each admission as a red carpet experience. The phrase refers to preparation and clarity, not luxury. Residents and families are told when therapy will begin, how often showers are scheduled, when meals are served, and what services are available. This is their home for the foreseeable future, and every detail matters, no matter how big or small, Miller said. That information may sound basic, but it carries emotional weight. A question about a shower schedule may also be a question about dignity. A resident asking when therapy begins may be wondering whether independent movement is still possible. Compassion also requires personalization. One resident may want family members involved in every discussion. Another may value privacy. One may be focused on returning home quickly, while another may be adjusting to long-term care. Every resident brings a different life, personality and set of goals into the building, Miller said. We cannot assume the same approach will make everyone feel supported. Miller is equally cautious about the phrase, above and beyond. He argues that providers should not grade their own generosity. It is our responsibility and our privilege to provide not just great care, but great customer service to those we serve, he said. Only a customer can say they received something more than they expected. That view places the judgment with the person receiving care and ties compassionate healthcare to accountability. Vertical Health Services believes strong leadership creates coordinated care. Residents do not experience healthcare as a collection of departments. They experience one continuous journey. When nurses, therapists, administrators, physicians, dietary teams and support staff are not aligned, patients feel every seam. They repeat information, receive conflicting answers or struggle to determine who owns the next step. Coordinated care depends on more than a shared medical record. It requires clear handoffs, consistent expectations and collaborative decision-making that gives residents and families a meaningful role. Vertical Health Services invests in quarterly, in-person leadership orientations for administrators, directors of nursing and directors of rehabilitation. The company began that practice early because Miller viewed leadership development as essential to the resident experience. Leaders receive the information and training, then take it back to their facilities and act upon what they have learned, he said. We expect all leaders to emulate our core values. The organization also provides mentorship and certification pathways, including wound care training. Its leadership team includes people who understand how policy translates on a night shift or during a difficult family conversation. Miller has led long-term care teams across several states. He received a 2019 Advocacy Award from the Washington Healthcare Association and now serves as the association's board chair. His experience reinforces a basic connection: workforce stability and patient confidence rise and fall together. Employees who feel trained, supported and heard are better positioned to offer the same steadiness to residents. Turning feedback into better care. Patient feedback becomes especially powerful when it directly shapes an organization's next steps. Vertical Health Services considers online reviews, testimonials and direct conversations alongside broader indicators such as community referrals, occupancy and census growth. Those measures do not replace clinical outcomes or safety data, but they can reveal whether families and healthcare partners view a facility as dependable. The proof is not found in one survey or one review, Miller said. You have to look at whether families are recommending the facility, whether community partners continue referring patients and whether people trust you enough to choose your care. Continuous quality improvement means connecting those signals to operational decisions. Vertical Health Services has invested in facility renovations, in-house dialysis services, clinical equipment and community partnerships based on local needs. Employees are also encouraged to raise concerns, ask questions and contribute ideas drawn from their work with residents. That feedback loop is particularly important in an industry navigating staffing shortages, reimbursement changes, rising costs and regulatory pressure. Healthcare excellence requires providers to adapt without allowing those demands to obscure the person receiving care. Technology can make communication faster, but Miller cautions against confusing speed with connection. Technology can help us communicate more quickly and more often, but it is a double-edged sword, he said. It can also become a barrier to person-to-person communication, which often brings greater warmth and clarity. The strongest systems use technology to support relationships, not replace them. Patient experience is sometimes treated as the softer side of healthcare. In practice, it shows whether clinical care, communication and operations are working together. Patients recognize quality in the explanation before therapy, the returned phone call and the confidence that someone is paying attention. For Vertical Health Services, compassion provides the human connection, communication provides clarity and coordinated care makes both consistent. Miller said the responsibility extends to residents, families and the employees entrusted with their care. Residents and families place their trust in us, and there is no greater responsibility than that, he said. Our staff also trust us to provide the training and tools they need. We owe both groups honesty, transparency and a commitment to keep improving without promising more than we can deliver. Trust grows from there, one conversation at a time.